Physical therapy and perceptions. So perception is everything in terms of the patient. So perception of their illness. So it has been shown that illness perception by patients determines their actual prognosis. So if they view their illness in a negative light, then their prognosis is probably going to be worse off. Same thing has been shown with therapy. So for example, patients with a positive perception of therapy will result in a better prognosis. And in this picture on the bottom here, I threw this in to illustrate the perception of illness. Because at first glance it's silly, but at first glance you think it's this big scary skull, but then when you actually look at it and kind of dive in deeper, it's actually not that scary, and it's just a car. Yeah, I thought that it kind of just illustrated perception of illness. Mind-body connection. And so a negative illness perception has been shown to be related to negative physical symptoms. So these negative physical symptoms are an increase in severity of pain, increase in muscle joint tenderness, increase in distress, just kind of showing that the mind can actually influence your actual physical symptoms. And then on the other hand, if you change your actual illness perception, there has been positive outlook. So for here in the second bullet point, there was a study that looked at myocardial infarctions in which they changed their illness perceptions, and it actually influenced the recovery time and the return to work in a more positive light. And on the other hand, there's a study where they looked at patients with lower back pain, and patients with lower feeling of control of their back pain had a worse clinical outcome after 6 months, where if they probably changed their actual illness perception, they could probably have better clinical outcomes. So diving a little deeper. So this is in terms of the patient and therapist interaction. When illness perceptions are properly assessed as in kind of looking at their health behavior, their motivation for treatment, and kind of room for education, it builds a better patient and therapist interaction, kind of building that foundation for trust. And the perception of the actual physical therapist. So this is kind of diving a little bit deeper into building that trust. And first impressions are everything. The presentation of the physical therapist, as in the presentation of their expertise, their professionalism, as their level of training and knowledge. A patient is more likely to trust those therapists in contrast to maybe someone that's maybe nervous or reluctant to try a treatment. Clothes have another big effect on the patient. If the therapist is dressed like the man in the jeans, they're probably not as willing to trust that gentleman rather than the man dressed in professional button-up shirt. And then enthusiasm. Enthusiasm has a huge role in patient outcomes and overall satisfaction. If the therapist is enthusiastic, optimistic, things of that nature, it can highly build that patient relationship with the therapist. And then eye contact. So again, these are all kind of building the foundation of that trust. And then kind of going more into that communication. So clear communication about the treatment and prognosis results in an overall positive experience. So clear and detailed diagnosis, explanation, kind of diving deeper, kind of feeling out what they understand about their diagnosis, then filling in those gaps. And then when you have finally gotten to the actual treatment portion of it, educating the patient on the treatment, why they're doing the treatment, what the treatment does, has had a positive experience on the actual overall treatment plan. And then organization of the therapist is huge. Being timely, being adaptable, just being clean, like cleanliness overall. These are all huge like confounding factors to increase positive experiences as well as patient outcomes. And then lastly, the utilization of the placebo effect. So us as therapists, physical therapists, we do not generally employ the placebo effect because, well, we're not doing research. And then also too, because most of the time when we employ a treatment, it's because it's backed up by evidence. So we usually don't do the placebo effect, but we can employ the placebo effect uh, concept, um, which would be to kind of change their perspective on the treatment to produce a positive effect. So again, kind of going into depth of the actual treatment, why it's used, and kind of shedding a positive light on that treatment to produce a positive effect. So kind of very similar to the actual placebo effect. And then again, so the positive message is associated with treatment for pain relief. So when you're describing the treatment, using things like this treatment will have a profound effect on your pain, or it will really decrease your pain. That's kind of just setting it up to be a positive effect overall. And that's all I have for you. Thank you.